Howdy y'all, welcome to my new channel, MPH Playbook by Lawrence. And obviously my name is Lawrence. I am a current grad student getting my MPH, and I decided to make this channel in order to give you the 411, the MPH 101, as well as like giving you my misadventures, tips and tricks into, navigating your MPH program. And obviously, as the title said, this is going to be an intro video about what is a master's in public health degree, who should get it, who shouldn't get it, and basically what does it all entail. And so just jumping right into the video, what is an MPH? Now, an MPH is obviously a master's in public health degree. You wouldn't click on a video if you weren't here for that. And basically it entails that someone has the knowledge in order to enter the space, as well as just like other master's degrees, it has specific competencies as well as specific niches that you can bridge into that. Such as my example, I am currently getting my healthcare management degree, but I'm technically getting an MPH. And so while I'm learning about accounting, while I'm learning about, finance, while I'm learning about organizational leadership, in order to run a health or public health organization, I'm also getting those core foundational knowledge of public health, which is biostats, which is epidemiology, which is, health policy and management. I'm trying to think, ecology, environmental, science, as well as like a slew of other things that, is core to the public health degree. And one last major thing that really gives a leg up to, MPH students is that they have a practical as well as, integrated learning experience, meaning that they're getting like field experience into the world of public health, and that is generally required in order for you to complete your degree. Like, for example, I'm currently trying to figure out my practical experience right now. It's a lot of things. I got different interests. I'm trying to niche it down. But pretty much, you can leverage that into like, a real life job, such as, if you work for a health department or if you work for a nonprofit, you can tell them about the projects you did and, not just telling people about, oh, I just learned about this theory or I learned about this, management, style, and just like keeping it vague like that. You actually have real world experience you can put on your, resume. And so that is a good leeway into my next question, or a common question you get about the MPH, and that is, what classes do you take? Now, I've said that, pretty much every MPH, program has something to its core, such as, biostats, epidemiology, healthcare management, all that. Basically, there's about 6 core major classes that, students at my school have to take that includes those subjects and a few more that is essential to the public health degree. But along with those core classes, you also take a lot of classes within your specialization. I know I already talked about my healthcare management classes, taking accounting and finance, but let's say someone has to take epidemiology or going down the epidemiologist, route. Basically, they had to take Epi 1, 2, Biostats 1 and 2, I can't pronounce the name, but basically, another courses in biostats, and just in general, take a lot more math and science-based classes, because generally that field tends to have more, science, math, and biostats within it. And those classes that I take, as well as that epidemiologists take, is going to be totally different than what a, social, health behavior, educational specialist might take. They're going to take a lot of, health behavior, social behavior. They might have a little bit of psychology mixed into it, and just like the theory of change, and just kind of like, the theoretical social model of, behavior. And so no matter what field you kind of go into, and whenever you're getting your MPH, generally, if you do try to get the degree, you're going to be looking at 45 to 60 credit hours, which most people finish within 2 years. Other people take a little bit longer because, life happens, family happens. You got a lot of older people who's taking their MPH, or a lot of like mid-level executives trying to, get that oomph in their career. And so they're taking an MPH now. And so they have a lot more things to juggle, especially with a full-time job. Another thing also to know, basically, you might also want to do a dual degree. I've seen a lot of MD students try to get an MPH, as well as a lot of MBA students trying to do a dual degree with an MPH. And so generally those credit hours are going to skyrocket. I think most programs require you have 75 to 80, credit hours, in conjunction with the other degree in order for you to get, the MPH. But like I said, it's just really, if you want to do a niche thing, that's that. But if you're just doing an MPH, it's going to generally take you about 45 to 60 credit hours. Now, going to the next question, what specializations are there? And pretty much there's a whole range of specializations, especially since public health can't really intersect with a lot of different fields. My specialization is going to be healthcare management and health policy. I'm more going around the public policy route as it is right now. And so pretty much, that details like government, federal policy, state policy, local policy, legal epidemiology, where we track like how legislation can affect, public health, and just a lot of other courses that deals with, legal and political theory. Like I said, there's the epidemiologist route, there's the social health behavior route, there is the biostatistician's routes, and pretty much there's a lot of different things you can do within the core area of public health. But I've also seen many different types of niches that form out of public health, such as culinary medicine, such as public health engineering, such as, pairing public health with just data science, healthcare marketing and communications, and, just a whole other slew of different niches you can really pair public health in, because like I said, public health really entails a lot of the world. And, it's very much interconnected in many different, fields, that a lot of people don't realize. So there are a lot of different niches that I probably haven't gone over in this video that are still out there that I implore y'all definitely go do your research and look on. Now, next question that a lot of people usually have, especially when they're like doing research on the internet and stuff, is that what is the difference between a MPH as well as a MSPH? Basically, if you're getting a MPH, you're going to try and be a practitioner in public health, such as actually doing field work, actually working with communities, working in the field of just, public health, community health, and all that in order to like affect change. While an MSPH is a Master of Science in Public Health. Basically, that's more towards research, academia, if you're trying to be a professor and all that, and just doing theoretical work and all that. That doesn't mean that those can't intersect. That doesn't mean that, MPH students just stay within that, realm for all their lives. Some people might end up going and get a doctorate degree or a PhD in public health or something like that, and just use that background in order to do academia. As well as you have many different researchers, public health, professors and, PhDs and all that, really get back into the field and really trying to help public health departments, communities, public and private, sector, businesses and all that in order to not only curb disease, but also create a better community and better, healthy population. And so while both have their different niches and have their different purposes, that doesn't mean you're going to be siloed at in the rest of your life. So that's something to consider. But like I said, if you're looking to be more like a practitioner in public health and actually work in the field of public health, I would say start out with your MPH. And so the next question would be, what should I look into an MPH program? Like what type of accreditation you need to look into? And what I generally tell people is that look into a CEPH, Council of Education for Public Health. That is pretty much the standard across, public health in the US. Now, if the school doesn't have it, that doesn't mean the school absolutely sucks, but it really kind of is frowned upon in employers and academics, professors and all that if your school doesn't have a CEPH, because we don't know what type of standard of education they might have. So definitely on the safe side, looking in your school has that. But if the field that you're trying to get into has any other type of accreditation that you might need to really, have the standard within that field, I definitely will try to go to an MPH school that also has that as well. Such as my example, when I was used to wanting to be a, healthcare administrator, actually go work into a hospital or a clinic or whatever, basically you need that CAMI accreditation. Basically that is the standard across, the field of healthcare administration, and many companies will not hire you if you don't have that accreditation. So my school had it. I definitely, I'm blessed to have it, because if I do want to go into healthcare administration, not public policy, I can fall back on that and I wouldn't have to worry about that, later down the line. Now, leaping over to the next question, basically, what do schools generally require you for your application if you're trying to apply for an MPH program? And all that really depends on what school you're trying to apply to. Now, just one thing to get out the way, usually most schools who are trying to get, an MPH program or who has an MPH program, they usually accept applications through a software called SOFIS. Basically, that is like the standard in public health, education. Everybody submits their application through SOFIS. And so everyone got similar horror experiences with that. So that's something to get out the way. But talking about the general application, requirements, basically you have to have a BS, in a certain degree. Now, some schools might require that to be in public health, especially if you're taking more rigorous, programs or courses within that program. And so that's something you need to look out for. But it's usually a BS degree, basically a letter of recommendation, maybe a few, 2 or 3, a resume and CV of your undergrad, and basically of your accomplishments and all that. And perhaps the most biggest components, which is the personal statement. Now, I'm going to do a follow-up video of like how to craft your personal statement and all that. But that's something that, you really need to take your time on. You really need to take your, thought process and all that, because you're basically telling the community, like, why do you want to be in this program? Like, what makes you qualified to be in this program? and why are you picking this school over any other school. And so that's something, you know, I'll explore more, and that's something you really need to take into account whenever you're applying. Now, notice I didn't say test scores, especially when you talk about the GRE and, you know, the LSAT and MCAT scores, you know, you can also use to get into grad school. And that is because a lot of schools are trying to get rid of their, you know, test scores after the pandemic. You know, people are starting to notice that, you know, hey, test scores don't really determine the strength of a class. You know, we have very good classes when we, you know, didn't have the GRE, so let's just get rid of it. And so a lot of schools are starting to get rid of it. Mine, you know, was paused, you know, for test scores whenever we applied, so I didn't have to take the GRE, which saved me a lot of money and time. But if you go to, like, let's say the Ivy League school and all that, they might still require the GRE, you know, because Ivy League is going to be Ivy League. So that's something you need to keep in mind. Another thing you need to look out for when applying to schools is that a lot of other schools will have additional requirements for you, such as certain schools, especially Ivy Leagues and like some of the top public health programs, they will ask that you take additional courses such as biostats, epidemiology, because a lot of times their programs are a little bit more rigorous and they require that people have that, you know, kind of background before coming into the programs to reduce kind of like, you know, dropout rates and all that. So that's something to keep in mind as well. As well as some programs might require you to have some type of experience in the field of public health, usually kind of like a gap year experience, you know, before coming in, especially when it comes to executive programs, when, you know, working professionals might try to get their MPH and it requires you to work in the field for, you know, a certain amount of time. And so this leads me to my last question, basically, who should get an MPH? And that is a very loaded question. And for me, you really need to have a passion into going to public health or doing public health work, because at the end of the day, you know, we have a lot of students who go into MPH programs not knowing what they want to do. They kind of have a general idea that they want to go into public health, but they don't know what specialization they want to do, or like what type of field they want to go into, or like have any like 5-year outlook to that. And there's nothing wrong with that. I am not saying there's anything wrong with that, but you should not be in a program if you're still in that state of mind, because those 2 years are going to snap by fast. But if you're really passionate about going to public health, or, you know, interested in the field of public health and have done some, you know, experience in the field and want to extend your, you know, knowledge into it, I definitely implore you to, you know, get an MPH. And another thing I really want to harp against is that don't look at the MPH program as a way to really just spruce up your resume. Or if you're looking to go into medical school and then you say like, oh, let me do an MPH, that looks good. Please don't do that, because we got a lot of people in space that are not really trying to be intentional with doing MPH, you know, work, and just really trying to go in public health work and just using it as a resume builder or using it to get to the next step and all that. Please do not go into the space doing that, because there is a lot of good fields, a lot of good work that you can do as a public health, you know, practitioner. And it's just that, you know, please, you know, just respect the space, you know, as it is, because, you know, we need people who are really dedicated, who has the intentionality to go into public health to really try to get these degrees, and not just someone who's just looking to go to medical school and not really like care about public health, in my opinion. And with that being said, that has been MPH 101. If you like what you see today, like, subscribe, turn on post notifications, all that wonderful good stuff. Please subscribe to the channel. I'm trying to build up this channel more, as well as subscribe to the other channel, my Pop Health Studio channel, where I talk about more about public health issues, current events, pop culture, media, and all that. I definitely think y'all will like some of the content over there. With that being said, stay warm, frosty, peace out.